It's an interesting question. So, how early you can diagnose? Very few studies have done longitudinal studies where they have done what are the pre-symptoms. Um, so, if you want to know the early biomarkers, it's very difficult to assess because most of the studies, like what we have done, is only once they have been diagnosed with something. You have to do a large scale studies and follow those kids who are at a higher risk, whether they are going to develop some kind of disorder in their life. You require a much larger cohort than what we have studied. So we cannot pinpoint a particular age or how early we can diagnose the shift in microbiome in this population. Microbiome studies are are progressing very fast, and one thing which we realize that if anything happens, um, like if the population or the kids get exposed to environmental factors which may be responsible for developing a risk of pediatric population for developing Crohn's disease, we can use microbiome as in a risk factor assessment. Okay. So what we did is that we compared the gut microbiome of this population who were treatment naive and see whether there is a dramatic changes between these two groups which we are studying in this population. So microbiome, if you see overall divided into multiple phylums have multiple genuses, and there are microbes which are specifically colonized in the gut. And if there is any trauma or any environmental exposure to toxins, or if there is a dramatic treatment, or if there is any pathophysiological conditions, this microbiome shift from a healthy microbiome to a dysbiotic microbiome. What we found in this study is that there are certain bacteria which are involved in causing inflammation, like fusobacterium, were dramatically altered in this population. I don't know if the group how well they are aware of FMT, fecal microbial transplant. So where they take a healthy microbiome from like a household control, and they can transfer that to the pediatric population or to the kid in the family, and they can restore the healthy microbiome and see the response is much good. But the studies were done in some population, but still at the early stage. But early intervention is possible, and the reason why we did is that we want to differentiate between other kind of gastric diseases than the Crohn's disease. So that's one of the thing which is remaining challenging, early diagnosis of Crohn's disease in this population. A lot of people, lot of time pediatric physicians cannot differentiate between these two disorders, other gastric diseases and Crohn's disease. So we showed here using a biomarkers from microbiome, we can differentiate these two diseases and start an early intervention in this pediatric population. So you're asking me a question that how the development of microbiome in the pediatric population at the baseline. So what we saw, the children with Crohn's disease showed significantly reduced microbial diversity, okay, which suggests the gut dysbiosis. There are certain bacteria associated with inflammation, like proteobacterium, fusobacterium, were highly enriched in the Crohn's disease as compared to the baseline normal naive treatment population. Beneficial bacteria involved in gut barrier protection and short chain fatty acid productions were depleted in this population. So there is a big difference between the bacterial population, those who produce healthy short chain fatty acids and metabolites, which keep the gut intact and reduce the inflammation. So, and microbiome composition, which we identified, also correlate with the disease severity, suggesting the potential of using that as a disease monitoring biomarkers. So that's a clinical implication of the finding. So currently we have published with 35 and around 100 control samples. We are doing a larger study with around 600 to 700 patient population. Currently the data is being analyzed and which we will be publishing in coming months, a few months. But definitely this preliminary work which we showed suggests that microbiome signature could serve as a non-invasive diagnostic biomarker for identifying the severity of the disease in this population. This definitely opens door for microbiome-based therapies, including probiotics, dietary intervention, or microbiome modulation by using FMT. This is an early stage, but it's a significant finding for us how we can use the microbiome to decide the severity of the disease. I hope that this will hold true when we are using a larger population. And at the same time, if something comes up, that will be very helpful in doing an early diagnostic in this severely infected pediatric population.